Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me Dr. Sascha Tuchman, a key thought leader in multiple myeloma. He's professor of medicine and director of the multiple myeloma and amyloidosis program at the University of North Carolina School of Medicine, premier institution here in the United States, obviously. And he's going to talk to us today about how he manages multiple myeloma in the elderly. So welcome, Sascha.
Great. Thanks very much. Happy to be here and to talk about this important topic. Thanks for having me.
So just as a primer, a lot of patients say they've never heard of multiple myeloma. So how big of a problem is it?
Yes, I would say that that's pretty common that when I meet patients, a lot of times they say that I was pretty surprised to hear that I have cancer, especially one that I'd never heard of before. So I agree that myeloma is very unlike things like lung cancer and breast cancer, where most patients have heard of that. Myeloma, some patients have heard of it, many not. So when I think about sort of how common myeloma is, I describe it often as sort of a medium common cancer. And what I mean by that is that here in the United States, so if we think about the most common forms of cancer, lung cancer, prostate cancer, breast cancer, there's 200 to 300,000 new cases of those per year here in the United States, versus the rarest forms of cancer where there may just be a couple or a few hundred. So those are obviously very uncommon. And then when we think about multiple myeloma, as we can see on this slide, it's usually somewhere around 30 to 35,000 new cases per year here in the United States. And so it's less common than the most common forms of cancer, but also not super rare. And so you can see it's the second most common form of blood cancer here in the United States. And then the other thing that this slide nicely highlights is that this is primarily a cancer of older adults. As you can see, the median age of diagnosis is age 69. I'd say, of course, so Dr. Vij, myself, so we in the who are myeloma specialists often meet patients who are quite a bit younger, but this is more so a cancer of older adults as opposed to younger people.
So how do you at the outset, when you do meet a patient first, in your mind, decide how you're going to approach the problem?
Yeah, so when I think about treating people with myelomas, it's of course important to highlight the fact that it's primarily medicine. So I call it chemotherapy, but it's not chemotherapy in the traditional sense where you lose your hair and get really sick, but these are medicines. These medicines are often generally tolerable when administered carefully and with careful dose adjustments, but nonetheless, these things can have side effects. And so we really have to think about an individual patient's ability to tolerate those side effects as they come up. And this is highly dictated in